Can we start the session? Okay. Good evening, everyone. Welcome to Vayomanasa Sanjeevani Monday webinar series. Today, topic of the day is anxiety in medical disorders. To talk about this, we have Dr. Isha Kaur Arora with us. I welcome Dr. Isha. And today's moderator for the session is Mrs. Annapurni. For introducing her, she is doing fellowship in geriatric mental health nursing. I welcome Annapurni. With that, I also welcome all the Zoom and YouTube participants to the session. On to you, Annapurni.
Thank you, Lima. So here we have today's session. The topic is on anxiety in medical disorder. So here in hand, we have an expert, Dr. Isha Kaur Arora, who has done her MBBS and MD in psychiatry in Jodhpur AIIMS. And presently, she has joined in NIMHANS as a senior resident in Geriatric Unit, Department of Psychiatry. So she is there with us to discuss on anxiety in medical disorders, and hopefully I'm expecting your participation in this. So we'll just, with no wasting time, I'm just handing over the session to Dr. Isha, ma'am. Ma'am, please, ma'am, you can start the session
now. Thank you, Annapurni. I'm going to start off. A very good evening to everyone. I'm going to start my presentation now. Is it visible? Okay. So a very good evening to everyone. My topic today is anxiety in medical illnesses. My name is Dr. Isha Kaur Arora. I am senior resident in Geriatric Unit, Department of Psychiatry at NIMHANS. Okay. So I'm going to start with, does anxiety cause physical illnesses, or do physical illnesses cause anxiety? So the answer is that they have a very bi-directional relationship. So anxiety may come because of physical illnesses, and similarly, anxiety may lead to physical illnesses also. So I'm going to show you some symptoms of anxiety, and then once you see those symptoms, you will be able to understand how these symptoms overlap with symptoms of physical illnesses. So let's see some symptoms of anxiety, like rapid breathing, increased heart rate, inability to sleep, headache, lightheadedness, dizziness, pain in abdomen, indigestion, chest pain, tiredness. All these symptoms are symptoms of anxiety as well as symptoms of physical illness. For example, a rapid heart rate or rapid breathing may be there in some cardiac illnesses, or in respiratory illnesses. Dizziness, lightheadedness, sweating may be there in neurological illnesses, or even in diseases of the heart or cardiac illnesses. Pain abdomen, vomiting, indigestion may be there in some gastric problems or in GI illnesses, and may also be there in anxiety. So the symptoms of anxiety and physical illnesses frequently overlap and may be confused for one another, and may also come because of one another. So they have a very bi-directional relationship. So let's move on to see how individual illness is associated with anxiety disorders, or how individual illnesses or system-wide illnesses are associated with anxiety. We'll start with diseases of the heart. So this is an image where a cardiac surgery is being performed. So cardiac illnesses Since I've already mentioned before, like cardiac illnesses, the symptoms of cardiac illnesses are rapid heart rate, sweating, increased breathlessness, and these symptoms may also occur in anxiety. So when a patient has cardiac illnesses, he may feel anxious. He may feel like he's having ghabраहट or anxiety. And similarly, when a patient who is having anxiety for a long duration of time is more prone for developing these cardiovascular illnesses. Also, people who have cardiovascular illnesses, who also have anxiety along with these illnesses, may have worse outcomes. Like, for example, if somebody is having CABG or coronary artery bypass graft, and after that develops anxiety, then the outcomes, new studies are suggesting that the outcomes for these illnesses are going to be worse in these patients. Okay, so they affect each other in various mechanisms that even like we are not very sure how, but they've been found to affect each other and also worsen the prognosis of cardiovascular illnesses. So moving on to neurological illnesses, depression and anxiety are very common in Parkinson's disease. And in some cases, before even the beginning of Parkinson's disease, in a prodrome period or in a period before the illness actually begins, patient may feel anxious. Okay, patient may have more anxiety or may feel more anxious. Okay, and in stroke, depression and anxiety are very common post-stroke or after the stroke has happened. Even in epilepsy, patients may have anxiety during the time of seizure episode or after or in between two seizure episodes. Even in other neurological disorders like multiple sclerosis or intracranial lesions or any other neurological disorders, anxiety and depression are quite common. So coming to endocrinological disorders like hypertension, diabetes. So newer studies are coming up which suggest that long-standing anxiety may lead to or may increase the propensity towards developing hypertension. And similarly, a long-standing hypertension may affect the heart and patient may ultimately have symptoms of anxiety. Similarly, in diabetes, patients may experience more anxiety. Diabetic patients may experience more anxiety, especially in older age, and more anxious people or chronically worried people or anxious people who have grave amount of stress are more likely to develop diabetes. It has also been shown that people who have diabetes and anxiety together, if anxiety is taken care of, some part of blood glucose control improves on medications. And if the patient is having chronic stress, then blood glucose levels go haywire and are uncontrolled. So, and similarly with hypertension also. So anxiety not only affects the development of these disorders, but also affects the control of these disorders that can be achieved on medications. So moving to cancer, as every one of you might be knowing, cancer is a very tough time if a patient develops it, and developing stress and anxiety, sleep difficulties during the diagnosis or post the diagnosis of cancer is very, very common. Also, if the patient has to undergo surgery, so pre-operationally or post-operationally, the patient may develop a lot of anxiety symptoms. We have to also remember that with cancer, it is not only the patient who develops these symptoms of anxiety, even the caregivers or patient's dependents may develop a lot of anxiety symptoms if their family member is going through this disease, especially because so much, like in general public, there is so much fear of developing cancer. So these issues also have to be addressed in cancer patients. Coming to respiratory illnesses, respiratory means like illness of breathing and all that. So it is found that in chronic tuberculosis is found in our country. It is found to be associated with anxiety and depression, and possible factors can be social isolation, poverty, stigma, or people feeling stigma that they have developed this tuberculosis. It may lead to more anxiety symptoms. Also, in common diseases like asthma and COPD, exacerbations or increase in the amount of episodes may also be linked with the symptoms of anxiety or development of stress. So coming to COVID, it is now well established that COVID-19 survivors are at increased risk of developing mood and anxiety disorders. Mood disorders means disorders like depression, etc. And anxiety disorders means like these anxiety symptoms, feeling fearful, feeling afraid, tension, feeling worries. 3-month post-infection, it is very common. Anxiety also occurs to general people in light of lockdowns and social isolation, and may also occur if some family member gets COVID, or they have to take care of a person who gets COVID, or if a family member is quarantined, or if it is of the family member has developed an illness and lives far away. So in these situations also patient may develop worries and anxiety symptoms. So other illnesses, so anxiety can occur in light of almost any illness. For example, if somebody is going to have a surgery, then pre-operatively patient may have symptoms of anxiety, may be very worried if the surgery will go out well, and immediately after the surgery may be worried if there were any side effects, or when will he or she be able to come back to normal life. If somebody has developed kidney problems or stage 4 failure and has to be and has to have dialysis every few days, then also the patient starts worrying and having symptoms of anxiety. In osteoarthritis, when there is so much pain, or in autoimmune disorders like rheumatoid arthritis, where pain symptoms are there and patient is chronically feeling tired, he or she may also develop these symptoms of worries, anxiety, especially anxiety about their own health or what will happen in the future. Or if there is a life-threatening condition, then anxiety and worries about death may also occur in these patients. Women may also have these symptoms during or just post-menopause, when their bodies are changing and there are hot flashes and then they start worrying. These symptoms may occur. So it is important that we identify these symptoms early and treat them if the treatment is required. Okay, and you as family members may help your other family members or other loved ones or near or dear ones to help identify these symptoms of anxiety. So what can you identify? If the patient is very worried, he's constantly worried about what will happen about the future, what will happen to their own health, or just worried about anything in life, like not being able to come out of the worry. You see that they are constantly sweating, they complain of having palpitations or very high heart rate, or they are reporting that I'm feeling worried, I'm not able to calm myself down, or feeling very breathless, or heavy breathing is there, fast breathing is there. If these symptoms are there, then you can help the patient get help and get treated. So what are the methods of treatment? The treatment options available are pharmacological. Pharmacological are treatment options where we use medications like SSRIs. SSRI is the most common medications used, but in some other conditions, other medications may also be used. So if the symptoms are moderate to severe in intensity, then we can give medicines and the patient will improve. Other non-pharmacological methods, that is methods that do not require medicines, can also be used. For example, counseling or psychotherapy, where it is basically when we treat patients by talking to them, addressing what are their worries, what are they thinking, and slowly patients start to realize what are the problems with them and hence improve. So this is the treatment of counseling. And then some lifestyle changes are also found to improve the patient's mental state. For example, if the patient regularly exercises or eats well and on time or has a regular routine, these small changes and can also make the patient improve their anxiety symptoms or low mood, etc. So take-home points are that anxiety is very common in medical illnesses, and in most cases may cause worsening of these symptoms and worsening of outcomes. And also you have to remember that these symptoms are manageable. So it is better to consult a psychiatrist if you think that your family member who are having some physical symptoms and are also having anxiety symptoms, it is better that they consult a psychiatrist. And treatment can be done using medicines or pharmacological method and non-pharmacological methods like counseling or psychotherapy, or by making some changes in lifestyle. Okay. Thank you.
Good evening, madam.
Wait.
Hello.
Just give me a minute, sir. Yes.
Okay.
Yes.
Yes, sir. You can ask your question.
Am I audible, ma?
Yes, sir. Yes, sir. You're audible.
Okay. Thank you, ma. This is Jambunathan. It was a nice presentation. I would like to, basically understand certain things about this anxiety and mood. What exactly causes, what is mood disorder and what is anxiety disorder? What are all the differences?
Okay.
Number one question. Number two.
That is a very good question.
Okay. Number two question is, what is SSRIs?
Okay.
These two questions, ma'am. Thank you. Otherwise, it was a nice presentation. I could understand. Only these basic differences I could not understand.
Okay, I'm going to tell you about mood and anxiety disorders now first. Okay, so there are two types of disorders. First is mood disorders. Mood disorders means when we are feeling either very sad or very happy. Okay, so if we are abnormally feeling sad, it is called depression. Symptoms will be like very low mood, which is not improving even on things that the patient likes, and the patient is very tired. That is depression. Okay, if the patient is having ideas of harming himself, feeling that nothing good will happen in the future, that is depression. That is one kind of mood disorder. Second is bipolar disorder. That is the second kind of mood disorder, in which patient has phases. One phase is of low phase, like depression, like I just explained. And the other phase is of extreme abnormal happiness, working too much, not too much like working like every day, like he's not able to sleep, he does not want to sleep, and he's talking big things about himself, engaging in reckless activities, spending too much money, abnormally so, like that is normally not seen in that person. So if the illness is just low, it is called depression. If the illness has these two phases, it is called bipolar. Both of these are mood disorders. Okay, different types of mood disorders.
Understand.
Coming to anxiety disorders. So anxiety disorders are disorders of worries. Okay, so patient feels what will happen, I don't know. It feels very worried about things. Extreme worry is there. It may be about a particular thing. For example, about his own health, or about being very afraid of lizards, or it may be about every small thing. What will happen to my child? Will my child return home? Will my child not have an accident? Or it can be generally also there, like not about any particular thing. It's just there. Person is feeling very worried. Okay, like about small things that does not warrant a worry. You're understanding?
Yes, ma'am. Very much. Thank you.
So that is anxiety disorders. So when patient feels anxious, they may also have some physical symptoms. Like if you're feeling worried, for example, you have to write an exam, you're feeling slightly worried. So you will have cold hands, you will have sweaty palms, you will have sweating in your body, you will have a fast heartbeat or fast heart rate, you will have rapid breathing also. Sometimes you will have dizziness, some people have headaches, some people feel nauseous just before an exam when they are very worried. So these symptoms, these physical symptoms may also be there in anxiety. Are you understanding?
Yes, ma'am.
Yeah.
Thank you, ma'am.
And the second question, Now, second question, what is SSRIs? So SSRIs, I'll tell you the full form first, then I'll tell you what it means. Okay, so SSRI are selective serotonin reuptake inhibitors. It sounds very complicated, but it is not. It is just name of a type of medicine that we give for anxiety disorders. Okay, it is just one type of medicine that we commonly give for anxiety disorder. They are called SSRIs. There are 6 types of medicines that come under the heading of SSRIs. It's just a type of medicine that we give for anxiety disorders. Make sense?
Thank you, ma. Thank you. But
Okay.
most of these tablets cause a lot of sleepiness, ma.
Okay. SSRIs sometimes in some people may cause sleeplessness, sleepiness, but usually SSRIs do not cause sleepiness. Other kinds of tablets definitely cause sleepiness. Okay.
Okay. Thank you.
Okay.
Thank you.
Yes, any other questions? Yes, participants can interact and you can ask your queries to Dr. Isha, ma'am. Okay, ma'am, I'll ask you a query. Like people know, like among geriatrics, they'll be having, usually they doesn't want to go to hospital for some mild problems and all. They prefer self-medications. So like, you can just share some few points regarding like if the person get anxiety, or if they go for pharmacy and if they take medicines. So is it good for them? You can suggest some points related with that.
Okay, so okay. So in anxiety disorder, the usual medicines that we give are SSRIs that we've just talked about. But I, as a psychiatrist, would always suggest that you go to a doctor before taking any medicines, especially in old age, because side effects of medicines become a little more in old age. Also, sometimes the chemists, they do not know much about the illness, and they prescribe and they give medicines like benzodiazepines, which may sometimes cause harm to people also, especially in old age. But it increases the risk of falls. It may cause some cognitive side effects, or like it may cause some forgetfulness problems, or may increase the number of falls that the patient is having. So it is better to always go to a doctor, I feel, that will that so that you can get a much better treatment, in my opinion. That is there.
Yes, ma'am. Thank you, ma'am.
Okay.
Like participants can ask their queries.
Doctor, I'm just increasing. Increasing the scope of the question asked by her. See, what is the trigger point for a person to go to a doctor? See, there should always be a trigger point. See, every day I cannot be thinking that I want to go to a doctor. Then that by itself become a symptom of anxiety, or this mood disorder. So, what is the trigger point? What is the minimum? Yes.
Okay. So the trigger point or the minimum can be, for example, if you're feeling too worried about small things that do not require worries, right? You know that it is not required. I'm not sure why am I worrying so much about it. If you're having that feeling, then you can go to a doctor. If the worry is taking place the whole day and you're not able to stop it, then you can go to a doctor. If it is affecting your normal day-to-day activities, for example, if a lady is there, she regularly cooks food, but now she's so worried she's not able to cook food also because of her worries, then you can go. Or if there is a person who goes regularly to work and is not able to work right now because of his worries, then you should go to a psychiatrist. If the symptoms, so basically, if the symptoms are so severe, or if they are affecting your day-to-day activities, then you should definitely go to a psychiatrist. Okay?
Thank you, ma'am. Thank you. It's very clarifying.
Yes, any other queries?
So there's a question from Mrs. Anita Ramachandran.
Yeah.
Miss Anita Ramachandran. So the question is, what is the difference between panic attacks and anxiety disorder? Okay. So I'm going to tell you what is a panic attack. Then I'm going to tell you what is an anxiety disorder. Okay. So panic attack is a brief episode that may or may not be triggered by something, in which the patient feels excessive anxiety. He feels excessive heartbeat, excessive fast heartbeat, breathlessness, may feel like his body is tightening, and excessive worry that the patient is not able to sometimes place. And the patient may feel that something bad is going to happen, something very bad is going to happen. And he may feel that I'm going to die. It is so much. And usually it is so severe that patient has to be taken to a doctor, because sometimes a patient has to be taken to a doctor. It is so severe. So that is a panic attack. It is symptoms of anxiety only. It is a kind of anxiety disorder only. Okay, so anxiety disorders are various types of disorders that have anxiety as the main symptom. Okay, so there can be many disorders like panic disorder, generalized anxiety disorder, specific phobia. Like anxiety disorder is a bigger term. Panic disorder is a one diagnosis of among anxiety disorders. And panic attacks are what are the symptoms that are seen in panic disorder, basically. I'm not sure if I was able to clarify. If there's still a query, you can please ask again. Okay, you're welcome.
Yes, Sushila ma'am, you have raised your hand. You can throw your question.
Yeah.
Ma'am, please unmute yourself. You have just muted now.
Yeah, sorry.
Yeah, please.
Good evening, doctor.
Good
See, my
evening.
question is, when a person is having anxiety and having also some medicines, does this lead to mistrusting others and not wanting to cooperate or, agree with others in the family for any issues or anything?
You have to give me some more details. Like, I can't tell you with this amount of information.
No, it's like one of our family members only.
Okay.
So she is not able to fully believe certain things which others say. It's anxiety only. It's anxiety or whatever. She is on some kind of a mood upliftment medicine, some lower doses, I believe. But she doesn't want to believe certain things that the other members say. And for
Like,
her,
give me some example. What does she not believe in?
like okay, there is also a question of slight memory loss. So yeah, you said this before, but she doesn't want to believe or she doesn't trust us that what we said is true. So that leads to some kind of avoidable arguments or unnecessary these things. How does one deal with these kind of situations?
Okay, so I thank you, Ms. Sushila. I am very happy that you asked this question. The thing is, I have to see the patient in detail basically to come to a conclusion about it. If you're telling that he may have anxiety and he may have some cognitive, like some forgetfulness or memory issues also are there, then we have to first form a diagnosis. Like after assessment of the patient, talking with family members, you have to form a diagnosis as to what the problem actually is. And once we form this diagnosis, then we will be able to better tell you how to handle the situation, because I think that we need to evaluate in detail.
Yeah, I understand. My basic question was, she's not believing the things her own family members say, that this has happened and you did this or you said this. That is what I'm saying. But she's anxious that, for various things, I'm alone, etc., etc. So,
Okay.
so that is what. That is the
So when she's fighting, the thing is that you should not argue back too much, I feel. Just let her be and try to get evaluated by a psychiatrist. Okay? Don't argue too much. Okay?
Yeah, definitely. I understand. Thank you, doctor.
Okay.
Doctor, I'm going in for a fundamental question. What is the protocol for a patient in geriatrics department when somebody wants to consult in NIMHANS? What is the protocol now?
Okay. So the protocol is that first you have to get a screening slip. The screening patient will send you to the first time when you come, you have to get a screening slip. They will send you to the geriatric screening OPD. Once they send you to the geriatric screening OPD, you will be evaluated by a doctor, and then you will have to follow up with geriatric unit OPD. So the first time, usually when patient comes for screening, it requires a little more amount of time, but afterwards the amount of time that is required in follow-up usually decreases. Okay, but it may depend. If the patient has to get a detailed evaluation, then again, he will have to spend more time. So first of all, you have to go in screening, then you have to follow up in geriatric. Okay.
Thank you. Thank you.
Okay.
Yes, we are running out of time. Others can start asking your questions. Please utilize the opportunity. Yes, you can unmute yourself and you can ask question.
Mute. I need to mute.
ಮ್ಯೂಟ್ ಮಾಡಿದ್ರೆ ನಿಮ್ಮ ವಾಯ್ಸ್ ಕೇಳಿಸುತ್ತೆ ಅವ್ರಿಗೆ. ನೀವು ಕ್ವಶನ್ಸ್ ಕೇಳಬೇಕು ಅಂದ್ರೆ ಇದನ್ನ ಮ್ಯೂಟ್.
Yes, ma'am, you can ask your question. You're audible.
Can I go?
Yes, please.
Does anxiety also lead to diabetes and other disorders?
Okay. So newer studies are coming up which are showing that long-standing anxiety, chronic stress may increase the chances of a person slightly or by more, like slightly or more, that is debatable, to developing disorders like hypertension, that is increased blood pressure, or sugar. It is not directly linked. Like it does not mean that if you have anxiety, it will cause you to have diabetes. That is not there. Like chronic stress may increase chances of developing these disorders. New studies like that are coming up.
Okay, so it is not directly linked to your anxiety.
Yeah, it is not very direct.
It could also be one of the reasons.
Yeah, right.
Hello, madam.
Hello, madam.
Yes, please.
Good evening.
Good evening.
And good evening. I am Mahesh. I was working in the High Court. Last year I retired.
Very nice.
I think 4-5 before, while constructing first floor in my house, I had some tension and sleeping problem.
Okay.
And anxiety.
Okay.
Several things I'm taking treatment for 3-4 years. I don't know. I don't bother anything. That anxiety it will come automatically. What happens? I'm watching in the morning. I'm doing yoga, meditation, Suryanama, Pranayama. I'm doing that. Can we, what, madam, that if they reduce some tablet, something will become some.
So I understood that you have had this anxiety issues for the past few months, and you are on few years, and you're on medication for the same, and now you want to consult for reducing the amount of medicines, right? Is that right? Okay. So actually, I will have to see what kind of medicines you're taking and for how long you're taking those medicines and how much improvement in symptoms have happened due to those medicines. So for that, I think you will have to consult personally once. So you can come to NIMHANS OPD, and screening is there on every day. It is there every day, and follow-up we can schedule after that. Is that okay?
Where we have to come, madam?
NIMHANS, sir. NIMHANS.
You have to make scanning,
Screening.
What do you mean by that?
Screening. Like there is a screening OPD. Yeah.
So you can come to NIMHANS. You can make the registration over there. And if your age is above 60, they will be referring you to screening OPD. You will be having a first contact with the doctors, with the psychiatrist in gate number 1.
Your name, madam?
My name is Dr. Isha.
Doctor?
Isha.
Every day working day you are available?
Sir, screening will be there between on every days except second Saturday and public holidays. So you can walk in at 9 o'clock till 9 to 11:30. Registration will be there. You can make the registration, and the doctors will be keep on like on duty basis. They'll be there in the screening OPD. So on whichever day you visit, you can meet any one of the psychiatrists whomever is available.
I am taking treatment already.
Okay, sir. You can bring all those previous slips.
Mr. Swaminath, doctor from Rajajinagar.
It's fine, sir. You can bring all the previous investigations and your prescriptions, and you can walk into NIMHANS and you can consult the psychiatrist here.
Okay, then subject to that, any idea to remove anxiety? What should be done, and how we should physically solve the problem?
So if you want to reduce your anxiety levels in general, you can follow a better lifestyle. For example, you can exercise regularly, do yoga, eat good food, simple changes in your life, having a regular routine, sleeping on time, waking up on time every day, making an effort to have this regular routine can also help you reduce your anxiety levels. If the anxiety is too much, then you can follow some breathing exercises, like breathing very slowly for some time, very slowly, slightly deeply, slowly breathing. You can do these you can do this deep breathing exercise, which will also help you reduce your anxiety.
Then another thing, last 35 years, when my daughter was born, 2 to 3 years I faced that problem, and after that I come out from that either. And since 4 or 5 years, this problem has occurred now.
It's okay. You can come and show us once. It's fine. We will assess you for that. It's okay. You had it in the past. Usually people may have a recurrence, especially during the time of retirement or when women are having menopause. These times are stressful times. So people usually...
See, how to avoid anxiety, how it will come to mind.
How to reduce it.
Today we are here, do something. Let us take tomorrow. That type of man, for me, that anxiety will come.
Okay, so if the anxiety comes to your mind, you're asking how to reduce it at that time. Is that right? Okay. Anxiety comes...
So there is a crosstalk. Please mute yourself kindly.
So if anxiety comes to your mind and you don't know what to do, you can try to reassure yourself. This will last for some time. I'm having anxiety right now. It is okay. Everything will be fine. You can tell these things to yourself. You can try to reassure yourself, calm yourself down a little bit. You can do deep breathing exercise where you breathe in slowly and deeply. I'll show it to you and do it. Very slowly, you can take 5-6 breaths. So that also reduces your anxiety level. So you can do these little things that will help you.
Ma'am, can you please show lights on anxious avoidant personality? We call it as anxious personality disorder.
Okay.
What is the difference between?
I will tell you. So, so personality is basically how a person usually behaves or handles situation. Okay, personality is more inherent. So if there is a person who since childhood was slightly afraid of things, used to try to avoid things, and you was a bit worried about things, trying to not get into situations since the beginning, he's always been like that. That is personality disorder. That is anxious avoidant personality. On the other hand, anxiety disorders are something that you develop. For example, if there was a person who was not usually like this, who was outgoing, who would interact with everyone, and now suddenly has become withdrawn, very worried about things, that is anxiety disorder. If it is from the beginning, from childhood, the person is like that, that is more of personality issue. That is anxious avoidant personality.
Okay, yes, ma'am. So we have, yes, ma'am, thank you. We have a message in chat box by Mrs. Batmini. She has texted is there any simple tricks or advice to have a check on anxiety? And if the people with anxiety, how to deal with them?
Okay. So simple tricks can be what I just mentioned before, like improving your day-to-day routine, eating well, sleeping on time, and exercising regularly, doing yoga, doing meditation. All these things can be basic things that you can do so that any mental illness will come down. Depression, anxiety, they will reduce. If the person is, if you are having an anxiety attack, then you can try to reassure yourself, everything will be fine, it will go in some time. I'm just having anxiety symptoms right now. I'm thinking too much. I should try to relax. You can do the deep breathing exercise that I just mentioned. That also you can do. If your friend or family member is having a lot of anxiety, you can try to reassure them that it's okay. I understand. You might be having anxiety. You're feeling restless right now. Take some time, it will improve. And you can tell them to do deep breathing exercise. Sometimes patients are worried and they want to talk more, like they want to talk about what they are worried. So you can listen to them. Listening also helps a lot. So if they feel I'm going to die, then you can tell them it's okay. Nothing is going to happen. I'm here with you. I'm going to help you deal with this situation. Or if the person is saying that I'm so worried, I don't know what to do, you can tell them it's okay. You're feeling anxious right now. Everything will be fine in a few minutes. Just to try to relax. Like this, you can try to reassure them and calm them down. Okay. Don't try to fight with them or argue too much with them. Kya hoga? Like if you say, what will happen? Nothing will happen. Why are you behaving like this? That will cause an increase in the amount of anxiety. So tell them that you're with them and that you're there to help them and you can listen to them. And these small things only will help with anxiety. Okay. I hope I answered your question, madam.
Yes, ma'am. You got it, ma'am?
Yeah.
Like any other participants who'd like to ask question? Yes, ma'am. Like one more question I would like to ask you.
Yes.
Like, is this the anti-anxiety drugs, whether the people may end up risk for addiction? It is there. They may get prone to addict.
So there are two types of anti-anxiety medicines. One that work for a longer duration of time. They work slowly. They take time in acting and they work for a longer duration of time. That is the SSRI that I mentioned and some other medicines that are not SSRIs. These medicines are not, they do not have addictive potential. Okay, that will not let you to become addict. Okay, like what you're saying, right? That do not cause dependence. But there is another class of drugs called benzodiazepines, like clonazepam, alprazolam. These medicines, if taken for a long duration of time, especially in elder patients, may lead to dependence or what you mentioned as addiction. So that is why in elderly patients, we try to avoid or give for a short duration of time these benzodiazepines. And we give for a longer duration of time SSRIs. So there are two types of medicines. Okay, so usually here in NIMHANS and usually other places also, we give SSRIs more. So don't worry about that. Okay.
Yes, ma'am.
Okay.
Because now, like old age people, they used to say, I'm not getting sleep, and they used to take drug by themselves.
So usually when they take drug by themselves, it is usually benzodiazepine.
Yeah,
so
yeah.
It's better to come to a psychiatrist in that case. Is that right? Yeah. Okay.
Yes, ma'am. Like any other questions from your side?
Hello.
Yes.
Yes, ma'am.
Yeah. What are the side effects of the medicines which you are prescribing?
Okay. So the side effects of SSRIs can usually be gastritis, can be there. You may have some gastric burn. Then you can have some, like very rarely some bleeding problems might be there, but it's not very common. Usually sometimes people complain of gastric complaints. Sometimes people complain of slight headache. Sometimes people say that I get more sleep. And sometimes people say I get less sleep. So both of them are present. And usually these complaints are there commonly. Sometimes more serious complaints can be like some sodium levels in blood may decrease, but that is also not very common. And if we give slowly, increase the medicine slowly, then chances of these side effects also decrease. Then some sexual side effects may be there. So that has to be taken care of. And if you've experienced them, then you can come to the psychiatrist so we can change the medicine. So you have to remember that if you're ever having any side effects, it's okay. You can come back and tell us that I'm having side effects. So we will change the medicine. Usually what our patients do is they stop the medicine and then they don't come back. So then they keep on having these anxiety symptoms. So I want to tell you that if you're having side effects, come back to us. We will change medicine and then you will not have side effects also. And your anxiety symptoms will also improve.
Thank you.
No problem.
If any other questions,
can I ask you?
Yes.
See, sometime back I read in the newspaper, this is something not connected with anxiety or anything. Sometime back I read in the newspapers that NIMHANS is looking for volunteers in this, Ayush department or something like that, where they are undergoing some treatment, some tests, etc. They wanted able-bodied volunteers as well as, patients. Can you throw light on that topic?
Okay. So in NIMHANS, usually there are a lot of research projects that are going on. Okay. So sometimes there might be some advertisement in the newspaper or something that we require patients and healthy volunteers for some research that is going on. So whenever you volunteer for a research project or anything, they will always tell you in detail about the research project, what is going to happen, what is not going to happen, what to expect. They will take your consent. You may choose or not choose to be a part of that research project. It is totally on you. If you decide in the middle that I don't want to be a part of this research project, you can totally walk out without any problem, without it affecting your treatment in any way. So research is an important part of medical field. Okay.
Yeah.
So we have to keep trying new medicines sometimes. We have to keep trying new methods of treating patients, etc. We have to do that because then only we will be able to provide better services. But it does not mean that if you're taking part in a research, then you have to undergo some trial method of treatment. It is totally dependent on you. You decide if you want to take part, not take part. It will not affect your treatment in any way. And if you want to walk out in the middle, you can still do it without any problem. That is completely fine. Okay. So research is usually going on.
This is something about alternate medicines.
Okay.
Paper is about alternate medicines, and I think alternate medicine department also there in NIMHANS.
Yes, it is there.
It is there. Therefore, it is only for that. No, I was just wondering how many times. See, in fact, my friends are interested. How many times you have to visit the hospital? That is the real problem.
I didn't understand, sir. Can you please repeat?
In fact, supposing somebody signs up for volunteering, how many times that the person has to visit NIMHANS?
Acha, okay.
That is the real point, ma'am. See, especially
valid. Yes.
Yeah.
So I can tell you about psychiatry department or in geriatric unit where I work. So usually the first time that the patient comes is screening. Sometimes you have to send the patient for a detailed evaluation in the next coming week or coming few weeks. So that is the second visit. Then eventually, once the medications are decided and settled, we ask the patient to come for a regular follow-up. So if the patient's symptoms are very severe, initially we ask for a more frequent follow-up, like once in every 2 weeks or a month. And once the patient's condition stabilizes, we ask them to come for follow-up every 3 months or every 1 to 2 months, or sometimes even 3 months when the patient is quite stable. Okay.
Okay. Yeah. The same is the case for volunteering also.
In counseling, it is different. So in counseling, initially you may have to come more frequently, like every week or once every 2 weeks. And then eventually, as your symptoms settle down, then you can come like once every fortnight or once every month, like that. So counseling, because more frequent sessions are required, you may have to come more quickly.
Thank you, ma'am. Thank you. Okay. Thanks for an excellent session, ma'am.
Thank you.
God bless. Bye.
Let us wind up now.
Okay, okay.
Yeah. So really we had a good interactive and informative session by Dr. Isha, who had a good experience in meeting all the patients, and she has discussed elaborately about the anxiety in medical disorders, and she has just given answers for various questions which the participants has thrown up. Thank you, ma'am, for your presentations. Thank you so much. You have patiently and politely, so softly have explained all the content in detail, and you have answered for all the queries which asked by the participants. Thank you so much, ma'am. We are very pleased to you have with us. And also I extend my thanks to all Zoom and YouTube participants who have kindly participated in the session, and you have just participated and made this interactive session very fruitful. Thank you all very much. I also
Thank you so much
to our co-partners of this Vayomanasa Sanjeevani. That our partners are Government of Karnataka. I also extend my thanks to Bangalore Apartment Federation and Happy 60 Plus, Indian Psychiatric Society, Karnataka Chapter 1, Samadhana Counseling Center, NSC Foundation, REC Foundation, Icon Life Sciences, Karnataka State Legal Service Authority. So I just once again I thank you all, and this day has been successful and very informative also. Thank you all. Thank you. Bye.
Thank you so much.
Thank you.
God bless you all. Take care.